My name's Melanie Davies and I'm a Professor of Diabetes Medicine at the University of Leicester and co-director of the Leicester Diabetes Centre along with Professor Kamlesh Kunti. Our city in the heart of England has a very diverse and multi-ethnic population which has one of the highest prevalences of diabetes in the UK. In our centre we focus on a number of different areas which are important to improve patient outcomes. We focus on clinical delivery and try to deliver high quality, excellent care to patients both in the hospital and community setting. We also have a very strong focus on patient and public involvement because we want to develop research streams which are relevant to clinicians but also answer patient priorities. One example of one of our outputs has been the Desmond programme, which is a structured programme which we've taken from research to implementation. In the UK now there are nearly 200,000 Desmond graduates and we're delivering courses not only in the UK but in Ireland, Australia, Gibraltar and the Middle East.
The EDEN project is a project that we've developed within the Leicester Diabetes Centre. EDEN stands for Effective Diabetes Education Now. It's important that diabetes care is provided by healthcare professionals that are competent and efficient to deliver the service that people require to get good outcomes for their diabetes. So the EDEN project provides a series of modules and study days that enables healthcare professionals to have the correct knowledge and expertise to deliver a high standard of diabetes care. They can come to the LDC and undertake training in different areas such as insulin management, new and novel therapies, pregnancy and diabetes, clinical presentation, prevention of diabetes.
Following healthcare professionals attending EDEN modules and receiving the education, it's really important that this is followed up by some mentorship. That's actually sitting in with the healthcare professionals in the practice with the patients. So in effect, putting theory into practice. This could be both GPs, practice nurses and healthcare professionals, healthcare assistants. So the whole sort of members of staff can be involved within this support.
Some of the work that we did early on included the self-management education programs for people with newly diagnosed diabetes, such as the Desmond education program. We also led the work on classification of diabetes in England. Some of the work that we have done, we guided the NICE guidance on early detection and prevention of type 2 diabetes. Our work on ethnic cut points for BMI and waist circumference also made the NICE guidance as well. We lead the work on models of care for black and minority ethnic populations, in particular in relation to diabetes and prevention of diabetes. And finally, we lead the work that is making guidance on the evidence for physical activity interventions and the reduction in sedentary behaviour.
Here at the Leicester Diabetes Centre we have a real expertise in trying to harness physical activity-based therapies for the prevention and treatment of type 2 diabetes and chronic disease. Whilst we've known for a long time that things like 150 minutes of moderate to vigorous activity are helpful for prevention and management, we know that also that not many people do these, so we're really focused on trying to extend the range and options that people have when they're considering using physical activity as a therapy in addition or instead of medication. We're looking to see when people have a high risk of diabetes or diagnosed diabetes, how much can they help control their blood glucose levels by simply changing their sitting posture for a standing posture. And then right at the other end of the spectrum, we're looking to see the effectiveness of very short, sharp bursts of exercise, how effective that can be in helping people regulate their metabolic health. So people aren't having to stay in the treadmill for half an hour or an hour. They can do very short, sharp bursts of activity, and then that can be enough to realise some quite important metabolic benefits.
Over the past 10 years, we've tried to deliver a different model of research, innovation and education and clinical delivery. We work across academia with the university and also with the NHS in the UK. as well as working across primary care and the hospital setting. Over the last few years, the Leicester Diabetes Centre has been very successful in attracting funding. We've had over £60 million from peer-reviewed, highly competitive funding bodies, which allowed us to do very high-quality research. We've had over 400 papers published in high-impact journals in the last 7 years, with a focus on structured education, prevention, physical activity and new therapies. We also want to ensure that we expand healthcare professional training and skills and competencies so that what we learn from research can be applied in clinical practice. Thank you.